The OPTIMA project is a multinational study looking at ethnic and sex-specific algorithms to predict type 2 diabetes. We'll identify biomarkers for early prediction of diabetes, and these will then be linked to dietary patterns in the different countries. And from that, we'll build prototypes for dietary interventions, for which we'll do health economics evaluation to look at the cost effectiveness of such an intervention. And importantly, we'll look at patients' perceptions about this type of intervention to see would they be willing to do a dietary intervention that may prevent their risk of developing diabetes. Personalised medicine is critical just because the pathophysiology of diabetes differs in every population. So the risk prediction and the prevention strategies should be specific to each population. My vision for the future is to have African-specific recommendations for prevention of diabetes, and not only for African per se, but within different regions, because there's such variability, particularly in Africa. And so we're not just based on generalized guidelines that are developed in Europe. There are great benefits for being part of the ERA PerMed consortium, a collaboration, because everyone provides different perspective, expertise, and together we are a greater force, because we can look at a global perspective to try to prevent diabetes. Funding from the ERA PerMed program has enabled us to do omics-based research, doing proteomics and metabolomics, which we would not have otherwise been able to do. And now we can use that to implement that in 2 African settings and to look at different risk markers and biomarkers to understand pathophysiology as well as identify those at risk for diabetes. The wish for the future is to, once we've finished our project and identified the prototype for dietary intervention, is then to implement that dietary intervention in a multinational RCT to look at the effectiveness of this dietary intervention in the different settings and the different countries.